Good morning everyone. We are going to see about sternum bone today. Sternum is an elongated flattened bone that forms the middle portion of the anterior wall of the thoracic cage and serves as an attachment for several muscles. So this is also known as an inverted dagger or an inverted knife, you can say it, because this part forms the handle of the knife and this looks like an inverted knife. First there is broader, then it tapers down into a sharp, so like a inverted knife. Yeah, it can be divided into three parts: manubrium, body of sternum, and xiphi. Okay, first we will see about manubrium sternum. Okay, this is manubrium sternum. It has superior border, inferior border, and two lateral borders. Okay, this is called a sternal notch or jugular notch. Then this is the clavicular notch for forming the sternoclavicular joint. Yeah, it's right here, the clavicular notch. Next, it has anterior and posterior surfaces. Yeah, anterior and posterior surfaces. This is the part for the first costal cartilage articulation. Then at the just above the inferior process, we do have a small demifacet. It is an half facet for the second costal cartilage of the second rib to articulate. Then we will move on to the body of sternum. Yeah, this is the body of sternum. So these two have superior and lateral borders. This articulates with the manubrium, so it forms the manubrio-sternal joint. So this is the joint itself. So this manubrium and the sternum forms an angle called as manubrio-sternal angle or the angle of Lewis, which increases and decreases during respiration, during the phases of both inspiration and expiration. The normal value is 163 degree. This is convex forward anteriorly and concave posteriorly. There is on the superior first part you have another demifacet. It accompanies with the demifacet present in the manubrium too for the articulation of the second rib. Then followed by there is an articulation for the third rib, an articulation for the fourth rib and fifth rib. And this is the articulation for the sixth rib. And finally, this is also a demifacet. This is also an half facet. Another half facet is present in the xiphoid process. Anterior parts, there are attachments to oblique, pectoralis major, sternalis, sternohyoid, sternothyroid, and transverse thoracis. Okay, now we will move on to xiphisternum. So this is a xiphisternum. So it is the smallest three parts of the entire, all the three parts here, the manubrium, body of sternum and xiphisternum. It may be broad, thin, pointed, bifid, perforated, curved or deflected considerably to the left or right. It might be. Thank you.